there are so many diets out there, right? You have a low carb diet, you have a ketogenic diet, you have a low fat diet, you do intermittent fasting, you go to Weight Watchers, you get a paleo diet, whatever. All the kind of diets, essentially what you're trying to do is you're creating what we call a caloric deficit, which means you're just basically consuming less food. And then that less food is, it depends on what it contains, whether it contains a lot of carbs or it contains no carbs, or it has a very high in fats and proteins, or you're restricting the amount that you're eating when you're eating, or you're going to Weight Watchers and you're getting it's some kind of a point-based system and you're getting awarded for what you're eating, or you're eating a Paleolithic diet. So it depends on kind of what is the fashionable thing to do, but the best one around is your intermittent fasting, by all means. Ketogenic diets are very, very popular, but remember they have a lot of fat, which is not exactly a very healthy way to go. So when I think of patients with diabetes, I think of a few things that come to my mind. And one is that I would always want to know what my sugar is. And so I have to check my sugars. And then in order to treat my sugars, there are just two things I can do. Well, three things. I would exercise. My diet is very important. And then what kind of medications I would be on. Now, as far as exercising every day, half an hour, 45 minutes, all, if you can do it all 7 days, it's great. But if you can do 5 days a week, 150 minutes would be pretty good. When we talk in terms of eating well, we'll talk about intermittent fasting. And then the third was, how do you treat it? And that's a little long topic for this talk, but it would be either oral medications or it would be insulins, depending on where you are in the stage of diabetes. Not everybody who goes on insulin is a type 1 diabetic. That's something to remember.